Have you ever had a difficulty communicating with a patient due to a language barrier? How about when giving important instructions related to their healthcare visit and your explanation leaves a confused look on their face? I am speaking on this topic because it is a common daily occurrence for me at work where a large majority of patients I see are non English speaking. I am fortunate to be bilingual in Spanish. However, we have many patients that speak languages other than Spanish. My name is Javier Sanchez, and I am an x-ray technician for an occupational medicine practice, and I have experienced these difficulties frequently due to the amount of non-English speaking workers that make up a great deal of our patient base. I have put together some ideas to help where language barriers are an issue. Using visual tools or aids in teaching and communicating with patients will be highly beneficial. One example that has been utilized in most healthcare facilities is the Universal Pain Assessment Chart. As you can see from this chart, the range of happy to sad faces allows the patient to indicate how much pain he feels by pointing to the face. This can be done without much verbal communication. Also, it has the translated written pain questions. For example, if the patient were to choose mild pain in Spanish, I know it's un poco de dolor. But what if the patient cannot read his native language? This is not a frequent occurrence, but it does happen. As healthcare professionals, we must make sure effective communication is reached. So if the patient cannot read, translation services must be utilized. For me, explaining x-ray positioning, breathing techniques, and radiation safety, it is important because that is the field in which I work. Let's say I was a doctor giving medication instructions and the patient doesn't completely understand because of the language barrier and effective communication wasn't reached, but assumed. If the patient doesn't completely understand dosages, allergies, mixing certain medications, it could become a life-threatening situation. Since I work in x-ray, some examples of visual aids that would help me are laminated pictures showing different positioning techniques and how to hold your breath with a brief description in the patient's language. Radiation safety images may be showing a pregnant woman and to let the x-ray tech know they are pregnant. For example, this caution sign. Perhaps we can get it printed in different languages, perhaps have a female pregnant patient on there. So these are simple aids that will help to effectively communicate and will increase patient understanding, which will likely make the patient feel that they are important to their healthcare provider. They will have a positive feeling about their visit. The time was taken to ensure they understood. Addressing language barriers and achieving effective communication with simple tools will make the office run more efficiently, including less wait times for others, and have an overall improvement in your healthcare setting. Thank you.